Hey, my name is Mark Wolgin. I'm an orthopedic spine surgeon. I'm joining SOS. Well, I grew up in California and I went to school there. I went to college and medical school at UCLA, Los Angeles. I did my internship and residency also in the UCLA system at a hospital called Harbor UCLA, which is south of the main campus. And that finished in 1992. Then I did a fellowship in foot and ankle in Dallas, Texas. I went back in 2002 to do a fellowship in spinal surgery at Cedars-Sinai in Los Angeles, and I've been focused on spine surgery since then. The thing about orthopedics was it was macro, and you could see it, and you could explain it to the patient. You could show that there's a break in the bone, and people tended to get better. I don't know about other people, but for me, I think the highest level of existence is to be focused. I mean, these days with our phones, it's hard to have attention for more than 10 or 15 seconds on anything. And when I'm in spine surgery, the difference between a good and bad case is the thickness of the dura, which is the balloon that covers all the spinal nerves and keeps the spinal fluid around the brain and spinal cord and nerves. If I go through the dura, it becomes a very bad day. And so it's like walking on the edge of a roof, and I have to be so there. I'm not thinking about the song on the radio or what's going to happen next week or anything like that. And I look up and 2 hours have gone by. And just like if you were talking to a friend or watching a great movie or in a book and you're so absorbed, I think aside from sleeping, that's kind of as good as it gets to be alive. I'm often asked about my approach in caring for a patient. And I think I would summarize it by the message that I would give to the family practice residents that I would train when I was in Albany is treat every patient like you're going to see him at Thanksgiving. Patients really know and feel if you care about them. With regard to what types of spine conditions I treat, there's two big categories of why people have pain from spine conditions. One is what's called neurocompression, which is not enough room around the nerves. Think of a shoe that's too tight. You take off the shoe. And the other is from degeneration or arthritis, and people think of like a disc that's worn out or degenerated. Physical therapy is part of what helps people maintain their motion and strength while they're getting better. Movement is medicine. Part of joining SOS is having the opportunity to work at a facility they call SODS, which stands for Specialist One-Day Surgery Center. There are many things that can be done in a surgery center, like a neck fusion, 1 or 2 levels, a lumbar, low back decompression, where you're taking the pressure off the nerves, a micro, because a microscope is used, discectomy, removing the disc. So remember, the disc is like a jelly donut, and if it ruptures and it's got some of the jelly pressing on the nerve, that's like having a rock in your shoe. So you could do a case like that in the surgery center, and the patient goes home the same day. There's another condition that when patients have chronic pain, they might wind up with a spinal stimulator, which is a way to give electric current around the spinal cord and can help people who have end-stage pain issues. And those cases can be done in the surgery center. People often ask, what do I do outside of work? I have things that interest me, and they involve relationships and various types of movements. I've been a big fan. It's easier in Georgia without the snow of riding a bike. I even had a lizard go with me for a ride one time. I would go swimming. I like to dance when I can, and I like to travel. Recently we went on a cruise with our family. I like to ski if I can. When I go home, like for Thanksgiving, with my surgical skills, they usually have me carve the turkey, because I know the anatomy. A little bit of a wannabe drummer, and sometimes I've even been recruited to do some other odds and ends when they needed someone who fits in the suit.